The reason we're getting dental students involved in our program and getting you out of the confines of the four walls of your operatory is just a chance for you to see that dentistry can be done outside of the office. And the only reason you would take dentistry out of the office is if there's a need for it. And long-term care dentistry across North America, what we're finding is that there's a huge not only a neglect with oral health, but also a void in getting dentistry into these facilities. And the reason is because long-term care residents, 80% of all long-term care residents have some form of dementia, Alzheimer's, and what that creates is an access to care issue, where with their dementia, they're not able to go to a regular dental office. Right? Some of them have physical disabilities that again doesn't allow them to go to a dental office. So they're a segment of the population that can't seek regular dental care like you or I would. Right? The reason long-term care dentistry now is become more relevant to dentistry is that 20 years ago, 15 years ago, the majority of long-term care residents didn't have any teeth. They had dentures. They were edentulous. So their oral care wasn't relatively difficult to acquire. What's happened in the last 5-10 years and what's going to happen in the next 20 years is that all of us are at the tail end of our dental career, but you being at the beginning of your dental career, you're just going to start to see the baby boomers reach the retirement age, and in the next 20 years, they're going to be ones entering long-term care facilities. So with our mode of delivery in using mobile dental equipment, what you're seeing here is our residents then have to be in Broda chairs, which simulate a dental chair as the best that we can, not having a dental chair here. But it works quite well. Ergonomics, of course, is a bit of a challenge, but you can actually do basic dentistry without having a dental chair or a dental light. Dentists will use, again, loops which are on their eyes along with a surgical light that allows them to be able to see within the mouth. And from a basic dental perspective, what we do, Tyler, a dental student here, is doing a filling for rows. You end up in long-term care, most of the mouths, because the residents aren't receiving any daily care. There's a lot of plaque and debris in their mouth. They're on a number of medications, which tends to dry out their mouth a lot. A large number of them have their own teeth, but these teeth, again, have suffered a bit of neglect over the last few years. So when you get into a long-term care setting and your mouth is quite dry, you have a lot of plaque, you're on a number of medications as well, your diet itself is not a regular diet, but one that consists of food that's on a softer, a little bit more adherent to the mouth. It tends to stick around the mouth a lot, stick around the teeth a lot. And old teeth that we see have a lot of the roots showing, and the roots are very susceptible to cavities and decay. So here what we find is a lot of cavities along the gum line that, again, you wouldn't see in a regular office setting, but in this segment of the population, this type of decay is also very fast progressing. And we find that most of the restorations that we do, most of the fixing we do, are on the roots of these teeth in order to be able to try and maintain and keep these teeth, so that from a nutrition perspective, these residents can continue to use their own teeth that they've maintained for a number of years before they actually came into these facilities.
You can see, first of all, we like to start off with a bit of brushing. If you could zoom in on that. And we typically just brush their teeth. Often we see food particles, breakfast, lunch items on their teeth, and then this is a quick way just to introduce something in their mouth before we actually start the hygiene appointment. And as you can see, we're always holding hands, we're touching, we're relaxing them as much as we can. And once we've done this part, they seem to settle down. The clients seem to settle down, and we're able to do a little bit more treatment for them. And can you zoom in on that? we are constantly assessing their oral hygiene and what's going on in their mouths. And as a dental team, because we have Dr. Vargava here, and we're working as a complete team, if we see any concerns or problems, we're able to consult with Dr. Vargava or the dentist that's with us to be able to determine treatment that may be needed, or at that point he would be able to determine what needs to be done. But then we have to contact families, let the family know what needs to be done, and often we wouldn't be able to do that treatment that day. But at least as a team, we're working together, and that we're able to do the best that we can do for these long-term care patients in this facility. And just by even holding our hands and having this touch, we're able to get the treatment done a little bit easier, making them more comfortable. But it's not a typical office situation where we can complete patients easily. It takes many people for us to get Mabel here. We have to contact the facility, we contact the family, and then the facility has to book the room. We have to have the caretaker booked. You know, it's not that we just show up and we're able to do this treatment. We need to, there's a process that we do. Can you open Mabel? And if you can see us, how we're all bent over. So ergonomically, for all three of us to be working on Mabel, it's very taxing physically for us on all of our backs, and we do need breaks. And for difficult patients, and they're not all this difficult, but for difficult patients, we do tag team, where one person may start, and we need a bit of a break just to stand up and stretch things out, and then we continue on with treatment.
The other important thing is with a person like Rose is that physically she's unable to get to a dental office. So if a dental team isn't able to come to the facility and look after her mouth, look after her teeth, there's no way that she'd be able to get dentistry done. Plus, a lot of the residents too that we see have sedation on board, is that if we didn't come to the facility where they call home, again, if you tried to transport them out of the facility to a dental office setting, what we accomplish here from a hygiene perspective, from a dentistry perspective, you would not be able to achieve that in an office setting, because just the change of setting, the transportation from the facility to a dental office is enough to throw a huge curve in their life, that to try and do any dentistry for them in a dentist's office would be impossible. So not only do they not get anything done, but secondly, they're transported, the cost of the transport and the disruption in their day, and not really ending up any further ahead. So.
Ever since you were a little girl, you brushed your teeth?
I brush teeth. Oh yes.
All the
I
time,
brush
right?
teeth. I never fail.
Good.
And I'm still brushing teeth, and I'm 91 years old.
91.
And I'm still brushing teeth.
And you've got beautiful teeth. Yeah, they're in good shape. So we'll brush them a little bit, and then we'll put some varnish on them. And I know this is your first time here at our dental office. But are you happy that we're here? Does that make it easy for you? November. When the dentist comes to you?
Put her here maybe in March, we'll see her. So in March
So we're just going to brush gently, and we'll see how much we can get done today. So she's doing really well. Annie, you're doing so good. Here, you just hold my hand.
No.
It's okay.
it is, but again, it doesn't.
Yeah. So we're just doing the best that we can with what we're doing. That's it. Do you want to hold my hand?
There we go.
Yeah, just rest, Danny. There you go.
So that's
There you go.
important.
That's it. Oh, perfect. I love it when you hold my hands. I love it.
Then I ain't gonna be my
You
wife.
hold my hands right here. There you go.
We got involved in this about 6
Oh,
years
it's
ago.
so
6
good.
years ago. Those facilities,
So
I never
this
looked at it.
is how
but I do
difficult
know
it
that
can be.
In those 2 facilities,
And
the
Annie's had a
uptake
little bit of
was
sedation
significantly
before
different.
we've even
Once we
started our
told them
treatment.
that,
So
And
we're
on
trying to
average,
make it
a
as
long-term
comfortable
care
as we
resident
can,
needs
and
about, 200 to 300
she's doing very well. This is really good.
no.
Good, Annie.
No.
Yeah, well,
No, and that's
you
on
just got a
average.
little bit of breakfast on your teeth,
A lot
Annie.
of people are dentures too.
Just
so
a
they
little
require
bit of
it, so they're
breakfast we're gonna
important.
clean.
Yeah, so some people need 1,000.
So you
some
can
people
see
need
we'd
0.
never put our
So
fingers
on
in and
average,
out because it's not predictable of what
Canada, North America, any
what may
studies that are
happen.
done,
So we're
in one
we're
hospital,
just able just to lift the
the
lip.
average need was,
We'll give her little breaks between, and
so,
you
know,
can
the
see
government
that
said we
it's
got 10,000 residents. in,
extremely difficult for us,
Saskatchewan.
and
You're
as
looking
a
at, on average,
professional who knows what we're doing.
10,000. Good, Mel. Let's take a peek here for you.
Well, he's got those magnification.
So the bottom left we fixed for you last time. That's okay now?
Yeah.
All that aching and all that's
Yeah,
gone?
it's so good.
Oh, good for you. So if that bugs you or bothers you again, you just let me know.
Okay.
You tell one of the gals here, either the nurse or Deb, and then they'll let me know that something's bugging you.
Okay.
All
Thank you.
right,
Yep.
good. Unless it's a statutory holiday, in which case don't bother me.
Well, my teeth still act up in statutory hall.
That's good, Mel.
Well, you've worn them down a little bit, and those are your only two.
And do you provide any of her oral health care as a family member when you come to see her, or do you really rely on the staff that helps her with that?
I absolutely rely on the staff. I mean, that's why she is here, so that her personal needs are attended to. And then when I come to visit, it can be purely for a social visit. I'm not going to be the bad guy that's poking in her mouth. I can just be her. I can just be her daughter and her friend and enjoy the visit. I think that getting too involved in their personal care, especially if you were feeling like you had to come every day, would cause such a stress on myself that without very much time at all, you'd be in a burnout situation yourself, and your own health would start to suffer. So I think it's really important to rely on the staff, let them do their job, and then try to make your relationship with them stay as it was, which was, mother-daughter and family.